Okay, so this next session is focused on the Sentinel Coordinating Center's work to improve the awareness of Sentinel and its capabilities through messages that target key stakeholder groups, including patients and providers. As Sentinel becomes more publicly facing and as a core safety tool at FDA, and even as a national resource for evidence generation, which we'll turn to in the next session, it'll be extremely important to ensure that Sentinel's mission is clearly communicated to and understood by these important stakeholders and to the general public. A lot of work has been done, led by Steve Makita and others, in incorporating new strategies for communicating about Sentinel to these various stakeholder groups. So I'd like to introduce our panel. Steve Makita is the Sentinel Planning Board member and lead of Sentinel Engagement Partners Work Group, as well as a patient advocate. Following Stephen's presentation will be Sally Okun, who is Patients Like Me's Vice President for Advocacy, Policy, and Patient Safety. And then finally, Vinit Nair, Practice Lead for Government and Academic Research at Humana, has been part of the Sentinel infrastructure since its beginning, and will have a lot of reaction and comments to make regarding the communication piece of this. So I will be turning over to Steve for an opening presentation. As soon as we're ready? Okay, thank you.
All right, well, it's been a pleasure to be here all day, and thanks to Rich Platt, especially, to invite me to lead this group. A little over a year ago, FDA formed a multi-stakeholder work group to raise awareness among 4 critical engagement partners, namely the public, health advocacy groups, providers, and health plan members. The mission of the work group was to develop messages to inform each engagement partner about the Sentinel system, letting them know what a valuable tool it is and how it works, and to remind them of FDA's commitment to protect patient privacy. Next slide, please. The Engagement Partners Work Group was tasked with the following. First, we created a plan of action to increase awareness about the Sentinel system story, to shine a light on its successes, and to demonstrate its present and future value. Second, over the last year, we have developed customized messages to reach all 4 target constituencies, and we received input from all of the respective audiences. Next slide, please. Right, this is the Engagement Partner Work Group, my all-star team, if you will, who have contributed their time and expertise in crafting these very individualized narratives for the 4 key groups. It's my honor to lead this work group. This diagram illustrates the interactive and interdependent nature of our work group. Each engagement partner sector informs the respective Sentinel system stories that our work group developed and over the next year will roll out and disseminate. Next slide, please. Our work group efforts were framed around 3 foundational principles. Each of the 4 Sentinel system stories are open and transparent about the Sentinel system's purpose, its capabilities, and its successes. Each story has to be relevant and meaningful to the respective engagement partner group. And the specific narratives, as well as dissemination channels, must be effective and understandable for each constituency. Next slide, please. To be effective and consistent, our work group identified what are the key components of the Sentinel system, and each story coalesces around each significant component of this very important tool. And yet, not one size fits all. We created stories for 4 different audiences possessing different interests and needs. And yet, each story shares the same information about the Sentinel system. The public and provider stories can be found on the Sentinel Initiative website. We just launched it this week, and we invite public comment on these stories. Our work group succeeded at achieving an 8th grade reading level for the public story, which was no small task, given the complexity of the Sentinel system. The other stories for providers, health plan members, and health advocacy groups contain the same elements, but the sophistication of descriptions vary to meet the needs of the respective audience. Although the health plan members' narrative and the health advocacy group's narrative are complete, we did not include them here in light of the fact that they are templates and will be presented over the next year to these 2 audiences for their feedback and rollout. Next slide, please. Each narrative for the 4 target audience includes these 5 elements: introducing FDA's safety mission, and the fact that the Sentinel system is only one of several important tools in FDA's toolbox to ensure the safety of medical products. Second, what makes up the Sentinel system? Third, a description of how it works. Fourth, examples of Sentinel system in action. And finally, each story describes FDA's commitment to patient privacy. Next slide, please. Now, here is the screenshot of the Sentinel Initiative website. Next slide. And here is location of the Sentinel system story, which has been launched and features, as I've said before, the public and provider stories. We are focused here on the key components in the public and provider stories. This page describes how the Sentinel system works. It tells the public that the Sentinel system answers basic questions involving large groups and patterns among patients. How many people are taking the same drug or getting the same vaccine? How many are having bad side effects? How many are men and women? How many are young, old, pregnant, or take other drugs? You can see that the provider story tells the same story, but takes a different approach to meet the needs of the audience. Next slide, please. Next, we feature how FDA uses this surveillance tool and what it does with the information to help patients. The FDA gets important answers from the Sentinel system about bad side effects in certain drugs or vaccines. It studies this new information along with other information it gets from doctors and drug companies. Then the FDA decides the best way to make doctors and patients aware of these side effects. And the FDA can then decide how the best way to warn doctors and patients about taking a drug product. And you see the second version of that same story for the audience of providers. The work group thought it was very important to shine a light on Sentinel system's value. The first example comes from a 2012 study involving a new anticoagulant. The FDA responded to reports about patients taking a new drug. The reports received concerned patients bleeding too much on the new medication. Remember, this is 8th grade reading level. The Sentinel system gathered information not only from patients on the new medication, but also from a large group taking an older medication. The result was that the new medication was no less safe than the older treatment, and thus patients could continue taking the newer medication while additional studies were monitoring the safety of the product. That same story is explained in different terms to providers. Finally, the last element covered in the Sentinel system story is FDA's commitment to privacy. Now, our work is really only halfway complete, as Rich Platt almost daily reminds me. The work group will now focus on the dissemination and rollout of each message. There will be opportunity for public comment from each group of partners. The public message is now live, and we look forward to receiving further public feedback. We plan on sharing the health advocacy group story with thousands of health advocacy and patient organizations to encourage them to share the Sentinel system story with their members. We are collaborating with the AMA through its variety of channels, media, and workshops to disseminate the story to providers. Finally, we will meet with data partners, not only to share the story, but also seek their input and comment regarding their specific audience needs. I could not lead this group without the consistent and constant support, insights, and skills of not only Rich Platt, but Susan Farrow and Catherine Freitas. Thank you very much.
Well, thank you so much, and it's just such a pleasure to be here today and to follow and be at the panel here with Stephen. And the work that the group has done has been actually pretty remarkable. I had the pleasure of being a part of the meeting that was held last year that did inform on some of the things that we thought would be needed and would be relevant in thinking about ways of being able to communicate effectively to the public as well as to patient and advocacy groups. So it's really nice to see some of that work now coming into play and becoming and starting to be live. So one of the things I think that I just want to say at the outset is just the remarkable progress that's been made with Sentinel. At Patients Like Me, we've been following this right from the start early on, and we've often wondered what exactly might our role or might the roles of patients be over time with Sentinel, and it just continues to evolve and it continues to impress us in thinking about ways that at some points we will find ways for the patient voice to be more proactively involved and engaged. But I'd like to focus my remarks today a little bit around thinking about short-term potential and then long-term potential and where things might go. I enjoyed the opportunity to take a look at the live site and really spend some time looking at the public and the provider input that's on the website. And I actually, in response to Stephen's request for feedback, I actually do have some things I think that would be really interesting to think about as you roll out and go in further to bringing this information into other groups and start to see what the public meetings might bring you. One of the things I think that I felt a little uncertain about as I was going through the website, there really wasn't a place where I felt like I was on the home page and knowing where to go as a member of the public or even as a provider. So the Sentinel system story is really it's sort of a nice idea that shows up right there, but it's not clear that's where I should go and think about finding some information that might be relevant for me. So I think having something that's a bit more overt and obvious for people who are coming onto the site to say, gosh, what is this? And I'd like to learn more would probably be useful. I also think that I love the idea of the Sentinel story. I think that's a great concept, but I think there might be some real opportunity to personalize it a bit more. So on each of the areas for the 4 areas, maybe focus on a vignette or something where you actually bring a face to that personal story. So I think that might be a powerful way of being able to engage people in either someone from the FDA who's talking about their role or someone from the work group who's really been involved in thinking about ways of bringing this into the public and the patient advocacy groups. I always liked stories. For me, though, they bring a real touch of nuance and context, and I think that's sometimes a real great opportunity. I was also intrigued, I have to say, I work for a company that actually empowers patients. We really have very activated and engaged patients. And I thought it was interesting that even though I firmly believe in trying to be sure that we have the literacy level right, I think on the public page, we didn't have access to the links to the publications, yet on the provider page we did. So I think it underestimates the interest that the public might have in being able to access directly the actual or original research that was done. So I would suggest either being sure that you put those links or some references in there. Now, I understand that some of them may not be open access, so that's just another new issue that we need to be thinking about. When you start opening up information to the public, start considering whether or not the publications that come out of Sentinel, maybe they should all be open access. All of ours on Patients Like Me are. We're committed to that, so our patients don't have to ever pay for a publication that they may have been a participant in. So looking ahead, and in summary, I think the work that's been done has been remarkable, and I think you have an opportunity looking ahead this year, Steve, to think about getting the kind of input you need to make this information become more relevant and alive for people. A few things that I'd like to just recommend would be to consider a process to evaluate and measure the impact and effectiveness of these messages, to really begin thinking about how well did we do, did we miss something, is there an opportunity for us to open up some other ways for you to get the information that you think will be most relevant to you. I also wonder, might there be a future when the Sentinel system really does engage more effectively with patients themselves? Do we have an opportunity to think about creating modules that actually are created with the idea that people could use them? They could play around with it, and they could start to see some of the ways that information around drugs and their effects on people could be useful for them to actually just have some knowledge about in a more proactive way. And then lastly, I think given the emergence of activated and empowered people and the public and the patients and some of the things that we're all doing these days, I think citizen science offers an opportunity to engage people more effectively in thinking about how can we get answers to questions that maybe we don't think about in the same way as others might when given an opportunity to test and play around with tools that many of the scientific and the scientists and researchers have access to. I love the opportunity of integrating CMS data into this. I think it's just another opportunity for us to think about other sources of data, and I will put a plug in for patient-generated data. I think it's become quite ubiquitous, and we will continue to see that emerge more and more. So I think I'd lastly just say, I think I'd like to encourage us to think about how we leverage the knowledge and experience to advance the capabilities of the Sentinel system and the eventual system of EvGen in innovative and surprising ways with the inclusion of patients and the public in helping us figure out the best ways to start thinking about this resource. And more importantly, to really ensure that their voices are integral to this continuously learning system that we're trying so hard to accomplish and to build. And with that, I want to, again, thank Steve and the work group's work. I think it's been very impressive to watch what you've done over the last year, and I'm really looking forward to having an opportunity to see the further work that will be done this year. So thank you very much for the opportunity to make a comment.
So thanks, Sally and Stephen. I'll try to synthesize some of the, or at least weave my comments into what both Stephen and Sally have said here. Again, like Greg said, myself and the team have been involved with Sentinel for about 8 years now at different aspects. So we have managed to see the different, sort of the growth pattern of Sentinel. And all kudos to a lot of folks here, but especially Rich Platt here. I always say, there is the technical aspect of the Sentinel, the data, methodology, et cetera, and then there is the governance. And it's equally important, and I would argue in some cases even more, that the governance is what's making this program so successful the way it is standing today. And kudos to you, Rich, for that. So any kind of messaging. So one of the things that we always talk about is when we do messaging as data partners. So I always take this line from a movie, with good data comes great responsibility. So you got to be really careful how you use it, with what you use it. So for all the data partners that are out there, all of us probably wear multiple hats, right? So we are data partners in one setting, health plan in a different setting, a contractor to a provider in a different setting. So knowing all these different roles is actually key to telling the right story that Stephen was talking about here. So as an example, I'll start off with this. as health plans, I'll speak for the group that I come from at least, is that almost all of us, I can assure you, do run some kind of a program that is either evaluating medication risk and or communicating that to our plans or members in whatever way it is. So consistency of messaging with what we are finding from the Sentinel to what is probably already being communicated as a part of our daily operations becomes a very key aspect of it. At the very least, we don't want it to be contradictory. We want all this information sources to be complementary. But that being said, the analysis that the Sentinel produces may be different from the analysis that each individual data partner produces. And this is something that came up in some of the early dialogues with Sentinel, was that we would not consider any piece of information that comes out of an individual entity as complete, and rightfully so, because we don't have the data on the whole system. So to a good degree, we have left that up to the FDA to guide us, to say what's the right information, that then we can work with our partners to say how best to present this. So I would say probably there are three ways, or three pillars as I call it. That is correctness of information, consistency of information, and combining it with the partners that you're working with. So for a health plan, we can very often, very consistently work with both the drug manufacturers as well as our provider community. So how do we weave the message we're getting from Sentinel into these communication strategies with these partners? Again, I would stress, and I would keep stressing this, it's the worst thing to happen to give the patient the wrong information. And so how do we give the right information in the right way? And secondly, I would take a cue from Sally, what you said, is if a patient goes to these websites, it is pretty unclear for the patient what to do. I mean, yes, they've heard the word Sentinel, but is there a path to engagement? And I think we have not even probably discussed, do we want that path? In the sense, how do we create that path? What are the guardrails for that path? Does the FDA really want this to be a system where somebody can go and read and then, so what? Right? So what do these folks who are actually going to the site, what do they want to do? Do we want to create a path for that? So there are some of these higher level questions that probably need to be answered before we bring in engagement. And I'll encapsulate that by saying, before we bring engagement, I am almost positive we need to set some level of expectation. It's sort of dangerous to set engagement without giving guardrails around what can be expected, because that can lead to disappointment and other issues. So in conclusion, I would probably say that there is some work, so great work by Stephen and team here, and I'm hoping that we'll continue to bring in additional partners as we go along here, and maybe we'll try to find some ways of early engagement. So, for example, if you identify a particular topic that's of interest, how do we bring some of these messaging partners early on within the confines of the NPI that we all sign, the non-public disclosure of information? So how do we work with these messaging partners up front? So they might be working on similar strategies and similar programs within their organizations. So how do we bring that in? So when we are ready to message, we are not spending time now evaluating between all these partners what's the right metrics, but all these partners are already engaged up front to deliver a consistent message. So those would be my comments, and thanks for the comments here, Steve, earlier, for setting up the stage here, and thanks to you all for the opportunity.
Yeah. I echo that. It's a tremendous amount of work, Steve, that you and the group has been working on, and kudos to the at least what we saw from the website. It looks looks great and easily accessible. And I do get the point that a lot of work goes into targeted but consistent messaging that's relevant to the stakeholder and easily accessible. One question, and you touched on this a bit, Steve, but maybe get some further thoughts from you and others on the panel on the sort of push versus pull mechanisms for communicating information. So a website is great because you can if a patient or a health plan member or a provider really, they hear about Sentinel and they want to get more information, there's a good website that they can go to and and get that information. You did mention the potential for more proactive push, if you will, mechanisms for directly communicating this information out. What, I guess, is a twofold question. What do you think the need is for more emphasis there, and then what could be good avenues for doing that?
Well, I really appreciate Sally's and Vinit's comments, and we've discussed some of those. Some of those are, extremely compelling arguments to further our work. I think that, generally speaking, we've kind of placed the onus and the responsibility on the respective data partners. So we didn't want to dictate what the health plan's messaging would be. We thought that it would be a better strategy to present a template and then to meet with data partners individually. We wanted to avoid the element of surprise, but we were sensitive enough to the health plan members, knowing that it was incumbent upon them to communicate, and we didn't want to presume what channels of communication, i.e. patient newsletters, websites, in which they could craft their own message. So there might be a data partner who, after looking at the template, would say, well, we kind of like this work group, but we're not going to fly with this particular explanation, knowing it might open up, more and more inquiry. So we were sensitive enough to the data partners. As for providers, we were very sensitive to providing them with what the AMA asked us to do, to provide them with actionable messaging. We did not want to intrude the very special relationship between provider and patient, and yet we wanted to be sensitive enough to providers to provide them with the sort of information and narrative that might easily fold into an AMA Wire, a JAMA article, maybe a nice little workshop that in June at the annual conference in Chicago, maybe Rich and I can have a junket to Chicago and make some sort of cute presentation to the House of Delegates or whatever they have at the AMA. So I think we were sensitive, and notwithstanding, there are 10,000 health advocacy organizations, so we did not want, again, to mandate that particular message. And we thought that health advocacy groups know how to communicate with their respective members. Therefore, if we crafted a rather general template, we would leave it to them to tailor it for their specific needs. So I think the push is coming, but the customization and the individualization will still be honored.
Great, thank you. So as I was listening to that and to the presentation, I kept coming to in my mind, like, what are the questions that patients and health plan members might actually have? So there's a big push to really communicating Sentinel's story out specifically to the public, and if all goes well, providers and their health plans might also be consistent in communicating to their patients and members the story of Sentinel. What are some of the first questions that might come to a patient's mind, and where can they go to get this information? So if I think, just as a I don't want to say typical patient, but a patient, some of the questions that they might come up with are, well, gee, how is I just learned that my health plan, my claims, my data that Humana is I trust to protect, I'm concerned, maybe. How is my privacy being protected? Or the patient might be like, well, this is great. I want to learn about this new medication. Like, what did you learn so far about this specific medication? That's the second one I came up. And then the third one is, I love this, and I'd like to know that by my data being part of this system, that I'm contributing to something useful or to improving safety. So have you, are those relevant questions? Have you sort of contemplated what the patient or member might be thinking in response to this communication? Thoughts on that?
Sure, Greg. And you're reminding me to add something to my earlier line. With good data comes great responsibility and great liability. So yes, it is something that constantly, that rests in our mind here. But at the same time, I'd like to add a couple of things here to answer. Hopefully, we'll get some answer to you here. So this is where the consistency of messaging or combining with the rest of the partners goes in. So when a member or a patient, lets us know, hey, you know what, we are using your data, it is probably not the best idea to come from just one venue. But if it's an initiative that has garnered enough support across the community, if it is something that if it's not something that just Humana or somebody or a health plan is telling you, but it's also something your physician is telling you, if you're hearing the same consistent theme across the folks of the spectrum that you know and you trust, that builds a better consensus for the rest of the community. And then I'll go one step further here to say something else, which is all organizations, all of us are held to some standard by some agency, be it CMS by STAR measures or anything of that sort. So if we can find, as a suggestion, if we can find a way to weave some of these into those kind of metrics, I think you would find a lot more, encouragement among these organizations to start partnering actively, doing messaging. I mean, I'm just going out on a limb here. I mean, what if a messaging of this sort was a STAR point somewhere? I think that would be a critical measure. I mean, for hospitals, for example, if providers, if you're able to add, an X point because you're messaging effectively to your members, all of the information coming from Sentinel, imagine the impact it has on your organization. So I would look at consistency again. That's sort of the key word I tend to hop on here, and also trying to understand what are the interests of the partners in terms of messaging. And if you can combine both of them, I think you'll have a consistent message that's also I think you'll find a path that can be sustainable in the future. Thanks.
So it's a great questions that you came up with, Greg. I think for the public and for most patients anyway, the kinds of questions that they would likely ask at the get-go might be, so what's this mean to me? I'm not really sure I kind of understand all of that, but once they get to the point where they understand that their data has somehow been used for something, most people want to be sure that it's been used for something positive, or that there's been something that was learned from it, or it was used to connect some dots that maybe previously wouldn't have been able to be connected. So I think, and I think that certainly people may have concerns about privacy, but I think for the most part, the public today, anyway, is much more accustomed to the notion that they are generating a lot of digital exhaust in lots of different places, and we all sort of know that. So I think that we acknowledge that, and then we understand that there are mechanisms in place to protect that, as the work group has really brought out and highlighted. But I think the ultimate thing I would like to suggest is that with every project that is undertaken, or every opportunity to learn something new, that you almost build in a give-back strategy. A give-back strategy would mean for those 4 audiences, what's the message we want for that? And I'm impressed with the cardiovascular outcome study that was done in the diabetic medications, and I think that there's a story to tell there to the public. There's a nice story to tell there, and I think it's important that people understand that these are the sorts of things that this system can help the general use of medications in a safe and effective way can be told. So I think, again, it goes back to being able to identify what's the story that we could tell in a way that's personalized in such a way that actually means something to me when I ask that question, what does this mean to me? So it may not mean something to me because I'm not taking diabetic medications, but it may mean something to my mother who might be, or it may mean something to others who I know and care about. So I think, again, trying to weave in some personalization, making it relevant, but really thinking about the main question, what's it mean to me? And then how do I start to make sense of my valuing the fact that the use of my data or data from others like me, or people who might be quite different from me, is actually contributing to providing answers we would not previously have been able to answer.
So we do have time for questions in the audience. If you do have some questions, we have some mics in the aisle for you to go to. I guess related to that sort of same line of questioning, one of the maybe a question for Stephen is the provider messaging. So if I am a patient who is taking a medication and I hear about Sentinel's story, my I guess most frequent touch points with the healthcare system are either through my provider or at the pharmacy when I go on to get my prescription. And their initial question, to Sally's point, what does this mean for me? Is my data being used in the system? And it's probably likely that the pharmacist won't know. Some health plans are in, some health plans aren't. So we don't really know if your specific data are being, or the pharmacy might actually not even have heard of Sentinel. I'm not sure. But the provider, hopefully, if the outreach is successful, providers will increasingly become aware of the term. But just any initial thoughts on, has your work group contemplated that piece of it, of pharmacists or providers knowing if that particular patient's data are in?
Well, yeah, we've discussed that particularly with the AMA. We're encouraged with their level of commitment in helping us craft that story. I think that you're quite right that particular relationship is really, for want of a better term, quite sacred. We did not want to dictate to that provider group what should be said or what can be said. But I think that Vinit touches on a very, very important subject that was always a priority as we crafted these messages, and that was one of alignment. And it's one that Rich reminded our work group of consistently, that it was important for each group to tell its own story in its own way. But at the same time, we wanted to introduce all audiences to what we believed were the 5 major components of an extremely complex situation. Now, you're not going to reach everyone all of the time, but we thought that through that uniformity of messaging, that we can again remove the element of surprise, start introducing a rollout dissemination strategy, pull in more feedback from all of these respective groups, and then start honing in on maybe some revisions to that message. We've even discussed in terms of perhaps introducing an infographic, and that would help describe. Of course, I'm lobbying for the infographic to show a very diverse group of people, one in a wheelchair. I promised Rich that another person will be in a bow tie. And so I think that, with that approach, I think that, using that kind of infographic notion, we will be able to describe to the public, and the public taking in all of these groups, of what a valuable tool Sentinel is. So our initial push was to remove the element of surprise. Now it is to disseminate a message that is both wide and unique to respective audiences, and to put enough information out there that someone, as Sally says, when they look at the website, they're going to know that we were thinking of them. Are we done, with trying to accomplish that? No, but I think we've made a major step forward.
if I just think about like the last couple of years at the, this Sentinel annual meeting that we've heard, where's the patient engagement? How are you going to communicate to patients? And it's not as simple as just saying, well, it's on the website and patients can go there and see. I'm so impressed with how much progress has been made even from last year to this year in the sort of thoughtful approach to what the message is, how consistent it should be. It's not just putting more information on the website. It's the right information for the target audience, and there just seems to be so much energy and thought that was put into this. So congratulations on making this much progress. Richard, I think you do have a question in the back. Yeah, you can go ahead.
I think the work that Steve described was trying to make sure that you were using plain language that was targeted towards the audience that you were trying to reach. That's great. And Sally, I also really emphasize your emphasis on using stories to convey the message. Again, I think that's something that's very valuable in this context. Steve, I did have one question for you. What sort of evaluation did you do as you were developing the stories? Did you do any testing with potential members of the audiences that you were trying to reach, or is that something that's further down the road?
No, sir. So with respect to, we thought a lot about focus groups. One of our members on the work group is Consuelo Wilkins at Vanderbilt, and Consuelo has a number of what I think she terms patient studios or community studios. And we introduced early last spring a narrative or several narratives of the public story. And Consuelo's group consists of not just patients, but this particular committee that reviewed our stories had a whole host of individuals from various professional backgrounds, levels of academic degrees. And so we felt that that was a really great snapshot, if you will, of what the various audiences were. And again, we tested out on, the, with respect to the Data Partners Health Plan members. We had, two really, really great health plan member communicators helping us craft that story. And that story, the template is really quite different than all the other stories in its tone and its approach. Again, it doesn't leave out the critical elements of the Sentinel story, but it does present it in a way that is much more familiar and in the same voice as someone that in a health plan that they have a continuing ongoing relationship with. So again, it's not something that says, hey, guess what we're doing? It's, we've always been worried about your health, and we're a proud member of Sentinel, and we want you to know that we're doing this to help your improve your quality of life.
Thank you for that, and again, excellent panel. I really appreciate it.
Hi, you state your name and affiliation. Thanks.
Hi, my name is Rama Piruparde. I'm a global head of quality and regulatory for life sciences for Cognizant. So, to Winnie's point about data being very important in the sense that good data, responsibility and liability, and bad data can also cause problems, I guess. He didn't say that, but I'm saying it. The reason I'm saying that is I think I have more comment than a question, and how maybe Sentinel program, a great program like this, is going to prepare for it. This is really about the ensuing standards that they have, IDMP, SPOR standards in Europe, and it's also going to be adopted by FDA. This is called Identification of Medical Products, and SPOR is Substances, Products, Organizations, Referentials. Referentials are all about the controlled vocabularies and data sets. So there's a lot of standardization that's going to come our way. It's actually last July, one deadline passed and they didn't make it yet. But the point I'm trying to make is there's a lot of data, standardized data, data vocabulary, and data governance, data cleansing, and data removing the duplicates. All of that is going to be coming your way, and I guess it's more a statement for awareness than anything else. I think a program like Sentinel would be impacted where everything comes together. Thank you.
Great, thanks for your question, and I think this really does emphasize some of the points that were made on previous panels around valid and reliable tools and algorithms. There's complete recognition across all the users of Sentinel, it seems, of the best uses and the, when is it not appropriate, and how can we, and to the point that seemed to come up all the way through and started with Rich Mishitsky, was that the methods can't stop, and we need to stay ahead of methods. And your point around new standards and approaches, that is a continuous part of Sentinel to make sure that we are using the best methods and across the board. But it is related to the communication strategy and making sure that as you tell Sentinel's story, that and I'm not sure if this is a component, but emphasizing the the tools and the methods are state-of-the-art methods is potentially an important part. Any just comments from the panel on that?
I would actually agree with you wholeheartedly, Greg. I think the idea for the public, in any way, and patients to understand and trust that the amount of scientific rigor that's gone into creating this as a resource is really incredible. I think in some ways that's as important as highlighting privacy. Really having people really understand what's gone in to make this to be the kind of resource that it's going to be, not only now and in the future, is really an important message as well. So.
Okay, great. I'd like to thank our panelists, and especially Steve, and all the tremendous work that you and your work group have done to date on this. And it sounds like much more to come. We're all looking forward to those, to reading those messages, to the health plans. That was a good example of how the tone and the communication strategy does need to be familiar to the relationship that's already established with the member and the patient. So we're all looking forward to that. And thanks to our panelists for reacting. I appreciate it. We are going to move to the next session after a first break. So we'll go to break for 15 minutes and then start right back up at 3 o'clock. Thank you.